vulnerable in society, whether it's children from single-parent households, orphans, or children in the foster care system, the homeless, persons with serious and treated mental health conditions. According to your January 30th, 2022 interview with The Guardian, it seems that you're suggesting that we need to rebuild everything simultaneously with a purpose, being purposeful, as well as utilizing the arts. Could you expand a little bit more about how that, you said specifically that it's about changing core values with regard to what is important, how quickly what is important is supposed to be achieved, and it's about art and centering the artistic expression of their lives. It's about providing stability, which you said is a big influence on its own, and the absence of which leaves people's lives, sort of really faltering. So my question would be, if we're supposed to start, sort of reconstructing everything simultaneously, where would you begin and how would you measure the progress of this?
Well, I think fundamentally that refers to appreciating that a person's health, and particularly their mental health, is a feature or a expression of their interaction with the various societal and institutional structures that they come into contact with, and of course beginning with their families. And that if we were to address the issues that affect those units in the society, then we would be able to better predict and better support people's health and mental health, especially. So I think what tends to happen now is that people locate pathology in the individual and identify the individual as the inverted commas problem and try to solve the individual's issue. I think that if we address societal issues that lead people to develop mental health problems, then we would be in a better place to help them and in some instances prevent them from developing mental health problems. So when I talk about reconstructing or rebuilding everything, I'm really referring to looking at life and health as a holistic thing. And if we start from motherhood, helping mothers live more healthily, more comfortably, with as minimum amount of stress as possible, then the baby is likely to be healthier. And if we apply that principle throughout, whether it's school, whether it's the community people live in, whether it's the things that happen in society, we have to acknowledge that there is a responsibility to manage those things in a way that allows people to feel more a greater sense of belonging, and also a greater sense of a greater understanding of their identity as it applies in that context. So starting really means attending to the things that are causes of distress in the society, and at its most basic level, whether it's water supply, whether it's the roads, whether it's state of our schools, whether it's the training of our teachers, the support we give to mothers during pregnancy, alleviation of poverty, alleviation of social distress, dealing with domestic violence. I mean, there's so much stuff that we have to, I guess, organize a response to that allows for the people who are exposed to these things to be better able to manage them. So I think the first step to answer your question is to appreciate and acknowledge that, and in doing that, attend to the structures that deal with these particular issues in a way that highlights the significance of dealing with them for the benefit of people's health.
I mean, that seems to just make a lot of sense. So the question is, why is it not being done?
Um, well, I think it needs organization and I think a philosophical kind of shift. Um, Traditionally, I don't think we've seen those things as determinants of health, but there's now a lot of work that has looked at the social determinants of health, and uh, they that work is quite clear that the health of a society, the health of a community, is directly linked to the, if you will, the social experience that people have in that community. And if we can manage that more effectively, then health automatically improves.
Thank you. I want to just get into a little bit, about something that I observed when I was facilitating the Resilient Stars program, which is a program that the Robinson Lloyd Resiliency Group puts on as an early intervention process. About 60% of the children that I was working with in a small group context, we had about 5 children in that group. About 60% of them reported suicidal ideation, where they had dreams of harming them, killing themselves, or they said, they think about it all the time. Now, it was a little bit concerning to me when I had to call parents, as that's something that we are mandated to report in the US and everywhere else. If a child says that they have suicidal ideation, it's, something that we have to call the parent and say, this is what I've been told and these are the next steps. And I had noticed, or I observed, that parents would be upset with me. They would say no. In some cases, they deny it. In one very, rare situation, they just said, I don't want my child to be part of this anymore. And, so I wanted to ask the students, why would parents get so upset? I would think that it's an opportunity to intervene and to make things better. And they said to me they believe that parents would get upset for 3 reasons. The first reason would be feeling shamed about being called by some outside party to be told that their child had suicidal ideation. The second was fear that the authorities would investigate their lives and discover things that they did not want discovered. And the third was that some parents would feel relieved that they could finally get some assistance. In your experience, how can parents identify and effectively address and support children with suicidal ideation?
Well, I mean, the you have to ask the question, why would the child have suicidal ideation in the first place? And invariably, it would be because of some circumstance or some situation that is occurring in their home. So immediately, I think once you talk to a parent, they would be defensive because they would feel, well, are you suggesting or are you implying that I'm doing something wrong or have done something wrong to result in my child having these kinds of thoughts? Um, I think children, having said that, children are going through perhaps more difficult times than people appreciate. I mean, the pandemic, for example, I think the most devastating effects have been on the child and adolescent, young adult population. So it could be that their perception, the children, that is their perception of the world is also contributing to this kind of ideation. But I think it really comes down to communication. And I think parents tend to underestimate the need or the degree to which children need to be communicated with and communicated with honestly and openly, so that they would feel confident and comfortable. This is the children that is, to share those kinds of thoughts with their parents. As you noted, the implications of those thoughts might also be somewhat intimidating, because you would consider, okay, if my child is having this kind of ideation, do they have a mental illness? Will the authorities step in and do something? Will I have to take them to hospital? What does that mean? Will they actually kill themselves? So I think those questions would make it quite challenging for a parent to consider, and certainly on the basis of a phone call. So I think that is something that has to be managed perhaps more sensitively. I'm not sure that a phone call is the best way, but that's another discussion. Um, the other point is that many people feel that when suicidal ideation is reported, it is because the therapist or the instructor has introduced the idea to the person. And there's a long-standing literature about recognizing that when you ask people about suicide, or when you talk about suicide, it doesn't make them suicidal, because that is still a pervasive view among the population, that if you don't talk about it, if you don't ask about it, it's going to go away, or it's going to not come up, and the person is eventually going to deal with it. But countless papers have been written refuting that, and saying that most times when you ask somebody about it, it's a relief for them, because they get to talk about something that normally they would not be willing to talk about, because of all the stigma that's associated with suicide and mental health more generally. So I think that I would say for parents, the key is really to open up the lines of communication, have them constantly available and accessible, so that their children can come to them and tell them about how they feel.
Yes, agreed. Especially with the CDC, Center for Disease Control in the States, reporting that suicide is the second leading cause of death for 10 to 24-year-olds. And the World Health Organization says that it's the fourth leading cause of death for that population as well. So I think it's very necessary for parents to start having these conversations. And I liked your point on the sensitivity of how this information is disclosed. And I started after the third parent, I started saying, okay, how can I script this conversation differently, that it's a life-saving situation, and a lot of other people have experienced it, so that there's less of a guilt, a feeling of guilt or shame on the part of the parent.
Well, and of course, suicidal ideation um, is at the bottom of the pyramid, if you will. Many people have suicidal ideation, never act on it. So I think we also have to be careful not to sensationalize it,
Yeah.
or to turn it into something that makes it even more potentially pathological for the person experiencing it. And many people might have fleeting suicidal thoughts that really don't in any way impact on their behavior, or in any significant way. But of course, others, and this is where the clinical acumen of the therapist becomes important. There are others in whom those thoughts are likely to translate to some kind of action. And those are the people that we have to target and support. And again, how do you predict who would be who? So that
Mm,
that that also becomes a challenge.
sure, sure. Which, brings us naturally. You spoke about the pandemic, and again, in your January 30th, 2022 interview with The Guardian, you observed that mental illness was on the rise. So, as you talk about focusing on who's most at risk, how would we go about doing that?
Well, the idea, I mean, the pandemic obviously has been, especially stressful for children.